I met in medical school at Northwestern. I didn't know our first date was actually a date, but it turned out to be. So we started dating then and then got married in our 4th year of med school.
Amy and I have been married for 20 years. She's my best friend.
I met Dave and Amy when I was on the staff at Hopkins and they were in the residency programs. But I really met Dave down here when he was the head of Duke's lung transplant program. He always had the patient and Duke's best interest at heart.
Now I am the president of Raleigh Hospital. I do try my best every single day to treat people with compassion, concern, caring.
Dr. Zaas is a leader who never says never. He's a very competitive person. He's always finding ways to do things better.
We should all live to seize every moment, not be paralyzed by fear, because none of us know the future.
He approaches life with incredible energy and optimism. But Dave was coming to work and he wasn't feeling well.
Dave and I ran into each other coming from the parking ramp. He was experiencing shortness of breath and weakness.
Thought I had the flu, lots of sweats at night, a little bit of a skin rash, started to get fevers, started to get chills.
I ordered a chest x-ray and lab work, including a CBC.
I got the email reminder that your tests are there. I look at my blood counts and they're all abnormal.
He texted me a screenshot of this very abnormal blood count.
I received a call from Amy. It's one of those kinds of calls you never forget, so I was worried. What I did was to schedule them to be seen the next day to have the appropriate blood test. By 5 o'clock, we knew.
He looked at me and said, "Dave, I hate to tell you, but you have leukemia. You have AML."
It's like this out-of-body experience. I'm like watching us sit there with Lou Deal, telling Dave he has AML, and I can see myself shaking.
AML is a cancer of the blood-producing cells. It is generally a very, very serious disease.
Like many physicians, I thought I was invincible. I never thought I would get sick. I was scared. All we were talking about was, what are we gonna tell our kids? How do you tell an 11-year-old and a 13-year-old that dad has cancer?
I was just so confused and sad and overwhelmed. Didn't really know what was going on and what to expect.
I just thought he's the strongest person I know. He's a Zaas. He's got this.
We went to Duke Hospital, where I got admitted to the 9th floor to get started on my treatments. We had to figure out what genetic mutations I had. The hospital at night is a lonely place. It's quiet. Your mind thinks about all the things that you don't want to think about. For me, it was therapeutic to talk about it, to write about it, to share it.
Dave started the Caring Bridge. It's great to see people responding and just cheering him on. It helped me a lot.
As a friend, as a physician, and as an oncologist, we understand what the illness is and understand the battle that Dave was about to enter. We quickly got together along with the leadership of University Hospital and figured out how to keep the hospital going in his absence.
Dave wanted me to step in as interim CEO. They were big shoes to fill because they were Dave's. He had taken care of my mom as a transplant patient, so he and I have a relationship that goes way back. He'd given so much to me and my family. This was me turning back and giving back to him.
His executive team was incredible, and everyone else outside of that team doing their jobs well like they do every day.
As a physician, I wasn't used to controlling things. As a patient, I had no control. I knew I couldn't control whether I lived or died. I remember looking at Amy and I said I didn't want to be the doctor. I needed her to figure out what was next. I knew that the initial treatment was going to be a week of chemotherapy and at least 30 days in the hospital. They were scary days to know that you have no immune system and that any infection can get you so sick at that time.
It wasn't just the Duke Health System family coming together to support Dave. It was the community that came together. We all wore our Kick Leukemia Zaas shirt.
Knowing that Dave lost his hair through chemotherapy, a bunch of us all shaved our heads together and raised money for St. Baldrick's, a cancer fundraiser.
I was in Baltimore from February through the end of July, and then quickly moving to bone marrow transplant.
To find out that I was a match was pretty exciting.
At first, you're a little bit afraid. What am I asking him to do? Why is he gonna have to suffer? He never hesitated at all. 10 bone marrows in each hip. He goes, it's my dad. Of course I wanna do this.
After the bone marrow transplant, you just kind of wait and you're thinking, we have no control. Are these cells going to find their home in Dave's bones?
My question was, what's the soonest that someone has been back to work? Day 60. Good, I'm gonna do day 55. I wanted to set that record. They had shown commitment to me and my family. I needed to show and return that commitment to let them know that I was coming back despite what I was going through. In August, Jake had to fly back to Baltimore. He donated 2 units of blood and gave it directly to me so that the white cells of Jake's immune system would recognize the rest of my body as foreign and attack any residual leukemia.
It came as a big surprise to both of us how bad he felt when he got the graft versus host disease from the donor lymphocyte infusion.
I was trying to go to work. I couldn't eat. I couldn't think normally. My balance was off. It attacked all of me.
Those donor cells attack the skin, the eyes, the liver, the GI tract. There were days that I knew he could barely put one foot in front of the other. There were many days that I went and got my car and we went to Macon Pond.
We would bring him in the back door and get him into one of our infusion rooms. My first instinct was to be passive and ask him what it is that he needed. And quickly I realized that that's not the approach that was going to work with Dr. Zaas. I knew that I needed to take a stronger stance. Dr. Zaas, you need some fluids, we need to check your labs, we need to talk about medications.
My Duke Raleigh team took care of me during really the hardest point of my whole journey. You can tell who has real compassion. I don't think I ever realized it. We often talk about tactics, about what to say. After being a patient, spending a few months in the hospital, more than what you say, it's how you say it. We have the privilege and honor of caring for patients and their families. I think we owe it to them to make that connection, to develop that relationship, and to open ourselves up. I think that's what patients need.
There's lots of things to love about Dave. He would get up every single day and he would never give up on anything.
I like to do everything 110%. My hope in the next year is that I'll continue to decrease some of the medicine, get my immune system back, restart my childhood vaccines for the first time with my new bone marrow. I don't know what lies ahead. I don't worry about it. I worry about, do I make the most of every day? That's the true work, right? How do I make an impact? What are those things that I can do? I'm fortunate enough to enjoy today and to be physically, emotionally, and mentally well enough to make an impact.